Jhansi from Homeopathy 360, and today we are again with you on the another day of another session of Home Talks 2025, presented by Homeopathy 360 with collaboration to Parul University. And we have number of passionate homeopaths and professors, and today we have Dr. Heena Rawal ma'am, Director, Ahmedabad Campus, Parul University. A very warm welcome to you, ma'am. And thank you so much.
Thank you.
And thank you so much for coming up on this platform. And we are going to learn again from you, and we are very happy and we are very excited to gain information, insights from you. So I would like to hand over now Dr. Zeel to please begin this session.
Good evening to all of you. Good evening, ma'am. Myself,
Good
Dr.
evening.
Zeel Prajapati. I am pursuing PG from Ahmedabad Homoeopathic Medical College, Parul University. So today we have a one and only speaker, Dr. Heena Rawal, ma'am. A warm welcome to you, ma'am. Heena Rawal, ma'am, is academic director at Ahmedabad Campus, Parul University, professor and HOD in Organon of Medicine and Philosophy at AHMC, and also a PhD and PG guide at Parul University. She is a National Assessment and Accreditation Council Assessor, NABH Assessor at Quality Council of India. Ma'am is NCH Resource person for training of teachers for UG and PG CBDC. Ma'am has also been worked as a principal at AHMC, and she is a chairperson of many research studies. She has also presented a research paper at Second International Ayush Conference at Dubai. So we will learn a lots of homeopathy with our inspiring and dynamic speaker, Dr. Heena Rawal, ma'am. We are so happy to have you, ma'am, today. Now I request you, ma'am, please start your session.
Okay, thank you. Thank you. Is my screen visible?
Yes, ma'am.
Dr. G?
Yes,
Is-
ma'am.
Okay. Okay, so a very good evening to one and all. And I'm not very sure that what is the type of the audience, whether it is students or whether it is practitioners. But in spite of either they are students or the practitioners, case perception is something which we all homeopaths have to do it. And day in, day out in our clinics, in our practice, it is something which is an art which is to be practiced. Now, especially in homeopathy, I would say that this is the only pathy where the case perception, we usually call it as case taking or giving of the case. But I always use the word perception, and by which I want to convey that why I use this word perception, because when you perceive something, a concept is formed in your mind, and for a homeopath, it is very important that you have the concept of the sick whom you are going to treat, as well as the concept of the sickness from what a patient is suffering. So only considering the sickness, the disease, that is not homeopathy. But when we combine both the sickness, the disease of the person, as well as the person himself, then only we can form what we call the totality of symptoms, and on that we can select the simillimum. So it's very important that we all homeopaths have to perceive. So it is very importantly written in the third aphorism itself, because as we know that in Organon, the first and second aphorism is more about morality, that as a physician, what is correct, what is ideal, what is the moral of a physician. But from third aphorism, we can say that the real Organon or the real homeopathy starts. And in that, the first sentence is that the physician has to perceive what is to be cured and into each and every individual sickness. So that is what Dr. Hahnemann has started with. And so it's very important that we understand what we want to cure and what type of patient we want to cure. So when taking a case, see, if we go back to the beginning of Organon, in the very first edition of Organon, Dr. Hahnemann had written, "The truth we mortals need, us blessed to make and keep, the always slightly covered over, but did not bury deep." Now, this was the stanza which he had quoted on the first page of the first edition of Organon, by which he wanted to say that whatever is truthful, whatever is correct, it is just within our reach. We put a little efforts and we can reach to it. The same is with we homeopaths, to reach to the individualization of our patient, for the selection of the similimum, for forming the totality of the symptoms, selection of the similimum, then finding out the right potency, the right dose, to judge the susceptibility of your patient. So all these aspects, which are very important for treating your patient, are only possible by case perception. Now, this is just a brief outline that what is needed for case perception or for case taking, what we usually call. Now, the first thing is that we need the subjective symptoms. The subjective symptoms are always very individualizing, and the subjective symptoms, by which it is usually they begin with an I, and so they represent the patient as an individual. And along with that, there are some peculiarities, that is the PQRS symptoms, peculiar, queer, rare, and strange symptoms of your patient. So these symptoms, along with the subjective symptoms, will help you to differentiate what I've written, importance of individualization. So it will help you to individualize or differentiate your patient from a group of people suffering from the same name of the disease. So that is why we need these symptoms. Now, why we need to individualize? There are other pathies who don't have this practice of individualization. Why we homeopath have to individualize each and every patient who comes to us, irrespective of whatever may be the name of the disease or the diagnosis. Now, if we say that if we individualize, then and then we are going to find out the similimum, right? The similar medicine. If we are going to administrate the similimum, then and then the law of similia, that is similia similibus curenter, is going to be implemented and it is going to function. Now, if similia similibus is curenter is going to be implemented, then and then ideal cure is possible, rapid, gentle, permanent restoration of health. And if we are able to do that, then only our mission as a physician is accomplished. So it's very important that we find out the individualizing features of our patient, and some part of it, that to get these individualizing features, what qualities we homeopath also have to develop, we'll try to cover that too in this presentation. Now, see this aphorism, it is aphorism 6 and aphorism 83 also, where Dr. Hahnemann has talked about being an unprejudiced observer. According to me, this is the most difficult aphorism to be practiced in the entire organon. That is to become unprejudiced, because many a times we are so biased, we are having so many preconceived theories, and then we try to act upon those theories only, that I will give only constitutional medicine, or I will prescribe only on the concomitants, or I will prescribe only on the sensations, I will prescribe only on miasmatic prescriptions I will do. So there are so many bias complexes which are there in our mind. And therefore, here in this aphorism, Dr. Hahnemann says that before you start your case perceiving, you must be free of all prejudices, all preconceived theories, all biases which are in your mind. And therefore, you have to see only the deviation from the formal healthy state of the person. Now, see, this is very important, the deviation from the former healthy state. Like, say, for example, if the person is a very introvert person right from the beginning, he doesn't like to talk to people, he likes to sit alone, he likes to remain quiet. And now when he has got a disease and the patient is coming to you, then introvert, doesn't like to talk, you are not going to take them as symptoms, because that was the person's personality even before the sickness. So what is very important is that without any bias in your mind, without any preconceived theory, and with the help of all your sound senses, all your senses, you try to perceive, you try to find out that what deviations which have taken place in the patient, from the patient you try to find out, or from his relatives, his attendants, and try to see what has been changed. And that what has been changed is going to become your case, not what the patient was. It may be something peculiar which is the patient is having right from the beginning. As I said, that he didn't wanted to talk even before his sickness. So now if he is not taking, that will not become one of our rubric. So it is very important that you observe your patient without any bias, without any preconceived theory. Now, coming to the aphorisms. Now, see, this is a very, very important aphorism. And for that, the line which is written, listen very carefully to your patient. He is describing his remedy. Now, see, this is written by Dr. M.L. Dhavle. But this is a very, very good line, that you just listen to your patient. The patient is speaking the materia medica. He is telling you that what is his similum, but for that you have to condition yourself, that you have to listen to your patient. Where Dr. Hahnemann has written that keeping silence himself, he allows them to say all they have to say and refrains from interrupting them unless they wander off to another matter. Like, say, for example, the patient starts talking about something which is very irrelevant, that certain thing had happened to my father's this relative, and then he went to this place and this place. Now, see, if he starts going telling all these things, then you can interrupt that patient. Otherwise, if he is describing himself, describing his modalities, describing his sensations, his location, extension, then carefully listen to that patient, because the patient is describing. Like, say, for example, I always tell the students that if you are asking the patient that how much water do you drink? Do you drink cold water, very chilled water, or fridge water, or you drink matka water? Do you drink in sips or you want full glasses? How frequently that glasses you need? Now, see, you are asking questions and the patient will answer in monosyllables. They'll say yes, no, yes, no. You are drinking cold water? Yes. You don't like matka water? No. You drink frequently? No. You drink in sips? Yes. So it is monosyllabus. But instead of that, if you ask, describe your thirst, then the patient will have to speak more and you listen. So whenever in case perception, if you are talking more and the patient is talking less, then always keep a caution in your mind that somewhere you are going wrong. Your case taking or your case perception is going wrong. So this is again another very important aphorism. Now, a case well taken is half cured, which is again written in Organon. And therefore, if you want to cure your people, your patients, then there must be a thoroughness in your case taking. The inquiry, what you do, must be very probing. It should probe the patient. You try to bring out from the patient whatever are his sufferings. Now, therefore, in aphorism 95, he says that it should be microscopic inquiry. Now, if you study the patient, what Hahnemann has written here, that you study the patient physically, mentally, spiritually, emotionally, socially, see all aspects, all different parts of his personality in different settings, how the patient is behaving, what he goes through, all this is to be studied together. And therefore, he has written in a footnote of aphorism 108 that mongrel sect, he has used the word mongrel sect, and where he says, you must have come across that word, that it is a crossbreed dog, that like one who has studied homeopathy and is now practicing allopathy. Why? Because he did not know how to find out the simillimum, and so he failed in his cases and he switched to the nathopathy, and then he is giving blame to homeopathy. And there Hahnemann very nicely writes that simillimum are not like roasted pigeons that they will come and fall in your mouth. Like in foreign countries, they eat pigeon. Now they roast it, and so immediately you take from your plate and you can eat it. So here Hanuman says that it is not like that. You have to do painstaking, hard work, and you have to find out that how to find out the core symptoms of your patient. And therefore, such unpardonable laxity in taking the case is not allowed in homeopathy. That is what is conveyed in the footnote of aphorism 108 as well as in aphorism 95. So, this is one more aspect of understanding your patient. Now, see, when you are doing case taking or case perception in your clinic, right as the patient is entering in your room, you start your observation, the sixth aphorism, keen observation. Now you start observing and you start to see that the words the patients are using, sometimes in the language there are abuses. Now when he is using abuses, then we can make out the background, the upbringing of their patient, of that person, or he is using language, or his words are, or his actions are very sophisticated, very good language. The way he is conveying his complaints, it is in a very well mannered thing. So you can come to know about the upbringing, about the background of that patient, about his education, how well studied or well illiterate that person is. So you observe the words of the patient when the patient is talking to you, the action, the posture, how the patient is sitting, whether he is very restless, whether he is fidgety, he is touching everything, he wants something in his hand, or he is very calm, quiet. So the posture of the patient, the behavior of the patient, he's getting very angry while talking, or he is like crying while talking. So whatever is the behavior of the patient, the speech of the patient, the expressions on the face of the patient, the gestures, the how what type of expressions and gestures are coming on his face, like it is of compassion, or it is of anger, it is of grief, it is of loss, if it may be of injustice. So there are different ways, different things during your case taking which you come across, and which will help you in understanding the person as a whole. What is very important, because we have got that holistic approach to cure our patients. So to understand that holistic approach, it is very important that you observe all these things and then you come to the conclusion. Now, how one by one, what you will try to observe. Now, see, first of all, you try to find out the nature of the complaint and the pace of the disease together. Like usually when the patient comes to us, we try to find out that what is the etiological factor, how everything started. So we go to the cause, and then since how long the patient is suffering. So that is, we try to find out the pace of the disease. Now, that is, it will help you to know whether it is a indisposition, that is, it is just a mimicking sickness, or it is an acute disease, or it is a chronic disease. So that will tell you different, the nature of the disease. And it will make your work easy. Like say, for example, if it is an indisposition, then as written in Organon, that you have to make just little changes in the diet and regime of the patient, either the diet or the regime, whatever has caused the indisposition. And sometimes the medicines are not even required. If it is an acute disease, then you don't have to bother about giving a constitutional medicine or a deep acting medicine or an anti-miasmatic medicine. You have to just find out from the short acting acute medicines. So your selection will become easier. And same way, if it is chronic, then accordingly you will select from the deep acting or the anti-miasmatic medicines and you will give it to the patient. So by the nature, say once recently I had a patient, a young girl who was like around say 18 years of age, and a Muslim girl, and she had bilateral symmetrical eruptions, patches on both her wrist, ankle, with severe itching on the wrist and the ankle. And when she was scratching that part, those eruptions, there was sometimes oozing also from the eruption. Now it was very this thing, discomfort, giving discomfort to that patient. And she had a complaint of constipation with straining, with lots of straining. So many of, just I would like to tell you that many of her symptoms were like that of alumina. Now, because she was a Muslim patient, I just inquired that in what type of utensils you have your food. Your food is cooked in what type of utensils, and what are the utensils which you use at home. And she said that usually it is aluminum. We eat in the aluminum plates, and the food is also cooked in aluminum plates. Now, I gave her one dose of alumina, but along with that, I asked her to stop eating in those aluminum vessels, and preferably even her food is not cooked in that vessels. And within 9 days, her itching had completely disappeared. And for all, and then I had, as I said, I gave her only one dose or 200 of alumina. And within say 3 months, all like almost 3 months, all her complaints, like all her eruptions disappeared. So see, you have to make out that what is to be cured in a disease. Sometimes it is just a maintaining cause, what is written in organon, a causa occasionalis, which is not allowing the cure to take place. So the behavior, then here, the behavior of the individual. See, sometimes the behavior seems to be, I remember another patient where I had read in some of the books, I had read that case, that a patient was brought from, she had come from overseas for like NRI, and she was brought to the doctor by her mother, and she was highly learned, talking very intelligently to the doctor. And the mother said that she has got a psychological problem, but the doctor thought that there was no problem at all, because she was behaving very nicely, very intelligently, very smartly, and talking in a very fluent language. So the doctor felt that there is no complaint of, there is no problem with this girl. And then afterwards, they left the clinic. The lady went out, and then she came back again after a few minutes, and she said that in the lift there are too many dead bodies lying. So what shall I do? Shall I inform the police, or you will get it removed from the lift? Now see, this was a psychological condition. So sometimes the behavior of the individual can be misguiding, and so it's very important that you probe and go to the roots and observe the patient so very keenly, that if the patient is faking his behavior, then you are able to find it out. So you try to see these things in your case perception. Then how did the patient was, you ask the relatives or the attendants or the patient that how he was behaving, and whether he was desperate to take the medicine. That is very important, that whether the person had that desire to take the medicine. And during the consultation, you take the note of the expressions, how alert or dull the patient is, how silent or expressive, which I've already told, the action, the behavior, the language of the patient. Many a times mannerisms are cultivated. You have to find out what really the person is. See, I gave you the example of those dead bodies. Now that was a cultivated mannerism. And so everyone thought that the person is very sane, but actually the person was insane. There was one girl around 22 years of age, and she was having severe bouts of acne. It was like so much of acne on both her cheeks, even on her nape of the neck, on the back, and sometimes those acnes were very acne pimples. Sometimes it was very painful also. She was not very good at studies also, and she also had the problem of constipation. And she was like she was having different mood swings many a times. Now she was like with her mother. She came with her mother, and there was no any other striking symptoms in that patient. Now, once when she came alone, and when I asked her privately that why she was well, the medicines are not working on the acne. So whether she had some stress, and so she's not able to good at studies, and therefore it was a stress to her. And then she confessed that she was hopelessly in love with one of her professors at college, and he was a very smart looking, very intelligent person, and everyone in the all the students liked him. And so this man was very influential, and so she loved that man. And that person was not aware about her this one sided affection. And so she felt more frustrated, more helpless. She was not good at studies. She was not good looking, so that caused more frustration. And that professor, out of this thing, out of pity, or because she was not good at studies, he tried to help her. And whenever he tried to come close or help her, she felt more hopeless. And now see, this was because of the close proximity with that person. She was feeling more and more hopeless. And previously she said that she used to cry, but now she was not even able to cry, and so all her emotions were like bottled up. Now, to that girl, Natrimu 200 was given, because see, Dr. Kant has written that Natrimu is indicated for girls who fall in love with married men or persons unequal in status, and so they are not of the same status. And Netramute did wonders. It cured her acne, it cured her on the emotional level also. She realized that what she was doing was not correct and it was just improper, and she came out of it. She completed her study. Now she is like, since last year, 1 year back, she is happily married now. But see, this is the beauty of taking a case, the perception of the case, and then finding out the same words, the same language in our materia medica also. So that is what we do, is that we match the core of our patient with the core of the medicines which are there in our materia medica. So this is one thing. Then another, some other important points which you will observe in your patient is the patient looking in your eye and making a eye contact. See, sometimes the patient is not talking to you directly. They'll look around, or they have that feeling of guilt or something, the feeling of shame. It may be anything, or low in confidence. So you can make out that from the contact the patient is making, his expressions, his gestures, then whether he is like very sharp or intelligent, or he's very dull, he's very morose, he's very silent, whatever it may be. And many a times it may also happen that the patient is like, he is suspicious, he doesn't have trust, he doesn't trust you. And he looks like, sometimes he is sensitive, sometimes he is like very very indifferent to whatever you say. Now many a times we get patients where they say that they don't have faith in our pathy, but just because somebody has told, they have come to us. So now sometimes I had again a girl who was having acne all over her body, almost all body, the buttocks as well as the back and forehead and everywhere. And they were very painful, very angry, red looking, and she had diarrhea from eating outside. Whenever she went to a restaurant or something, she had diarrhea, she had sour eructations, aggravation by both. She was ambithermal, then she was weeping, and she kept on saying that someone in the family or a friend told her that just try homeopathy, so I have come to you, so I have come to you. Now see, from that I took the core of that patient as yielding disposition. Yielding, they themselves are not decisive. Somebody has told her to do this, and therefore she is doing. Because repeatedly she kept on saying this. So, yielding disposition is the core of that patient, and yielding disposition is the core of pulsatilla. They are indecisive. So, this sometimes such small things also can help you in finding out your medicine. Now, whether the patient is disorganized, very structured, you can ask that things to the patient. Is patient trying to be attractive, is trying to grab your attention, or irritated when your attention goes away? Or is the patient shy or embarrassed, uncomfortable, needs attention? Why does the patient bring with him? Who does the patient brings with him, and how does he relates to that person? So see, these are some of the tips. You don't know from where you are able to find out that whether the patient, how to individualize your patient, or how to find out you. It will help you in the selection of your medicine. So there are different ways. In aphorism 88 also, Dr. Hahnemann has written that you try to understand the disposition of that person, which I told previously also, that the disposition of the person is very important. If you go to aphorism 230, he says that we should not be able to cure homeopathically if we do not, in every case of the disease, whether even if it is acute, you observe along with other symptoms those related to the change in the state of disposition, which I mentioned earlier also, that if the patient is very quiet right from the beginning, and after his illness also he is very quiet, very introvert, then you don't take that introvert or quietness as your rubric, because that is the disposition of the person. But if the person was very cheerful and very extrovert, and now he has gone within himself, he is not talking, he is all suppressed, then that change in the disposition will become one of your very important rubric, which will help in selection of the similibum. So this is which is very important, that you try to understand the disposition, and the disposition of the medicine is matched with the disposition of the patient, then and then the cure is likely to take place. Now see, if you go in the footnote of the same aphorism, Dr. Hahnemann has very nicely written, he has given the name of the medicines, and he has written that aconite will seldom effect rapid cure in patients who are having a calm disposition. Aconite has to be restless. It is one of the medicine of the trio of restlessness. So aconite has to be restless. If the person symptoms are matching to aconite, like he went outside in the rain and then he has got cold and fever, so the symptoms might be matching. But that patient is very calm, quiet, he is sitting quietly, not at all disturbed. Now aconite has to be restless. So don't think of giving aconite to that patient. Another example which he has given is nux vomica patient of mild phlegmatic will not, nux vomica is never going to work in patients who are mild and phlegmatic. The person must be aggressive, the person must be ambitious, the person must be having acidity, the gastritis. So if the person is very mild, then don't think about giving nux vomica. Again, he has given the example of pulsatilla, that it will never ever work in persons who are very obstinate. Very obstinate means they are very jiddi. So obstinate, yielding, who are not at all yielding. They will stick to their words. They'll not listen to anyone. They are not reasonable. They cannot be argued. So don't think of giving pulsatilla to these people, because it is not going to work. Where again for Ignatia, he has written that persons who are not easily frightened or easily vexed, not getting angry easily and not getting frightened easily, then don't think of giving Ignatia, because Ignatia is a bubble, like easily they are getting like sorrow and they'll start crying bitterly. So all the emotions are heightened. So then only think of giving Ignatia. Now see, everything is written in Organon, that when you are doing case perception, how the different aspects of your patients, if you keep and observe it with minuteness, then it is going to become very easy for drawing the picture of the person and the picture of his sickness. What Dr. Kent has said, the sick means the man who is suffering, as well as the picture of his sufferings, the disease, together will help you in finding out your medicine. Now see, again in this aphorism, that is aphorism 96, he says that sometimes the patient is giving all his symptoms in an exaggerated form, especially the patients who are hypochondriac. They are too much worried about their health, hypochondriac. Now, these patients will give their symptoms in exaggerated, what it is, what actually they are suffering. They will overdo the things. So either the patient is a hypochondriac, or the patient may be a very sensitive person, or say he is impatient of his disease, of his suffering. He cannot bear it, and therefore he'll give a exaggerated expression, or who loves to portray his symptoms in vivid colors. Like some of the people know, they like want to show that they are very sick, or they are very depressed or very sad, especially the housewives. So sometimes it may happen that you don't get the real picture. So you have to be cautious that whether the symptoms what the patient is saying is exaggerated, the whether it is the correct picture or not. And in aphorism 97, Dr. Hahnemann says it may be just the opposite also, that they are giving in a hypo way. There it was a hyper way, this is hypo, that they are not telling exactly what they are suffering from. Like it may be their nature, their character, that they are very shy, or they are very modest. They don't want to say what exactly like they feel that their ego will be hurt if I talk about my illness. So they are very modest sometimes, or they are mild of disposition, they are having weakness of mind also, or they are indolent, or they say that they may be describing their symptoms, maybe lack of vocabulary, or due to any other reasons they will be describing it in a very vague way. So there can be such two conditions also, that either exaggerated expressions, or there is low or hypo expressions. So with your wisdom, with your experience, you come to know that whether what the patient is saying is the complete picture or not. So you have to be vigilant about this also during your case perception. Now, again, another important aphorism as well as footnote, that is of 93. Now, see, I've taken a picture where there is that tunnel-like pipe, and I'm trying to show that some of the questions, the physician has to be very cautious. And they have some of the questions which you are asking, you see to it that you don't ask them in front of their family, sometimes in front of the attendant who has come, or in front of your attendant, your attendant who is sitting over there, because there may be certain things which the patient does not like to be interrogated, or to express it, or to tell it in front of somebody. So you have to be very cautious about it, that sometimes they will not speak spontaneously in front of a relative or something. And so you have to frame your questions very carefully, so that the patient may not go in his own self, and you may lose the rapport with your patient. Because it is very important for such questions, you have to create a rapport with your patient. And after creating a rapport with your patients, you ask such questions. Like, say for example, it can be some extramarital affairs, or some past heart failures or love failures. Then it may be an attempt of suicide which the patient might have tried. I have seen a patient where there was a cut on his wrist, and there was a keloid formation, and from that I had a suspicion issue. He was wearing a full sleeves shirt, but suddenly the sleeves went up and I could see that cut. And so very cautiously later on I had to ask that whether you have tried or attempted suicide. And then he started crying, and then finally he said that yes, he had once done this. And so, see, there are certain questions which may come to your mind. You may not ask directly. It may be questions related to abuse. Like, say, for example, I had a girl who was abused in her childhood by her grandfather. And therefore she did not wanted to get married because she hated the opposite sex. Now, initially, I was thinking that she has got like hatred for the opposite sex. And therefore she didn't want to get married. But later on, I came to know after 4 5 visits that actually it was not aversion to the opposite sex, but it was etiology was abuse. It was due to the abuse which was done to her in childhood. So such questions many a times when asked after 4 5 visits or privately, then the patient may come up with that. There can be related to debauchery, there can be related to some domestic violence, there can be related to some bad habits, it can be alcohol or any other things, or there can be conflicts in the family between the husband and wife. It can be some grief or misfortune which the patient has felt many years back, and that grief is still there, and therefore the symptoms, we are not able to find out the right medicine. It can be an insult, it can be an injured pride, it can be some injustice, it can be injustice in childhood, injustice at the place where he is working. It can be some superstitious also, which the patient will not tell you directly. Privately, when the patient is asked, then he can come up with that. There are many such things where, and I've got many such cases also, but as we have got limited time, so I can't discuss all the cases. But there are certain things where you have to talk to the patient very silently, very privately. Then it can be imperfection in the genitals also. Such things, it can be impotency, it can be infertility. So certain things which you need to talk to the patient privately, and it is very important that you give due importance, due respect to the dignity of your patient, and talk to the patient alone and try to find out these things. Now see, sometimes how you judge the things, the patient may disassociate, projection, and spontaneous denial. Now see, these are the things, like say for example, jealousy or vindictiveness, or says superstitiousness, suspiciousness. Now see, the patient will try to disown. No, I don't feel jealous about anyone. I don't have that. I'm happy with what I have. I'm not, never ever jealous. But then during the case taking, he keeps on saying that, okay, my brother has got a car, I have got a two-wheeler, but it's okay. I don't mind it. Or my brother has already bought a house, I still stay in a rented house. Now, see, this is the jealousy factor. But no patient is going to come and tell you that I'm a jealous person. In our materia medica, every third or fourth drug is jealous or suspicious. But then in your clinic, how many people are going to come and tell you that I'm a jealous person or I'm a vindictive person? So while if the patient is trying to disown some of the emotions or some of the things, that shows that the patient has indulged into it. The patient feels it, and therefore repeatedly he keeps on saying that no, I don't mind it, I don't bother it. But actually they are feeling those emotions, so they will try to disown. Sometimes they'll try to project, like they'll try to pinpoint that, okay, I'm not doing this, this person is doing this. I'm not trying to give harm, or I'm not trying to give some loss to one person, but this person is doing. So again and again, if that projections are coming, then also it can indirectly indicate that the things which the patient is denying, maybe he himself is doing or indulging in those things, and spontaneously, no, I don't do this, I don't know. So see, whenever there is a spontaneous denial, certain things indicate that the person is doing it, and therefore it is very important that again, this reminds me of a police officer, a very at a very high post. Now he kept on showing that he's very disciplined, very well mannered, very well educated. I don't do this, I don't believe in this, I don't. So everywhere it was denial. And then his symptoms, his wife also was coming for treatment. And I felt that she was very suppressed or something was wrong. And once when she came alone, I just asked that, I think that you are not happy in your marriage, or that is a direct question. We are not supposed to ask direct question, but that was very strongly in my mind. And so I asked that lady, and she said that my husband is so suspicious, because she was good looking, the husband was at a very high post, but not that very good looking or not very smart. Now she said that my husband is so suspicious that even I'm not allowed to keep a male servant in my house. If I, because see, they are police officers, so they get some male orderlies from the police force. The higher ranks get that. So usually those male servants which come from the police force, she did not allow because they were males. If I'm standing near the window, he always says that who is standing, why you are standing at the window? You are talking to someone, or you are like, what is somebody is there? And to that extent, she told me that if I've been gifted some good sari from my makeup from my parents, then he would with a scissors tear those saris. Why? Because he felt that if she'll wear a good sari, she'll look better, more good looking, and that he was suspicious. Now, see, sometimes when the man keeps on saying, "No, I am very disciplined, I'm very this, I'm very kind-hearted," if he keeps on saying this, then also it may be that the underlying current may be something very different. So, like, I was shocked here. The ladies once brought the sari and showed it, one of the sari, and showed it to me, that how he had cut at every places, that she couldn't wear in any form, like everywhere he had made cuts. So this is very important, that you try to understand the human nature. See, especially in chronic disease, Dr. Hahnemann has also written that for the case taking of chronic disease, it is very important that you understand the human nature. Then and then you are going to get the real picture of your patient. Now, see, these are the different things. Here again, what I said, knowledge of the human nature, which I already said. Now, you have to be very careful in whatever you are asking. Like, say, for example, you form the questions in such a way, caution in inquiry. See, when I'm using the word circumspection, then it is a caution in inquiry. You should be cautious enough. And then you are asking the questions. And then the real fact will come out. And you try to understand the fact then. As I said, that the human nature is very important. And above all, what is written in aphorism 98, patience is required. Sometimes you don't get the correct picture in the very first sitting with your patient. Because see, the innermost feeling of the patient, many a times, most of the patients are not able to come out with it. And so sometimes you may take 1 or 2 or 3 sit-ins with your patient, and you may, maybe you have given a placebo and then you are giving another medicine, or you may need to change the medicine also. So it's very important that you have enough patience with your patient when you are doing the case taking. So this is another thing. Then few other techniques how you can find out the subjective symptoms of your patient by asking the daily routines. When you are asking about the daily routines, the patient has to talk more. And so something may come out which is individualizing, which is something which is very striking, something which is very peculiar. Then it can be the daily household works which he is doing, he or she, or at the workplace, how is it, his social relations, how is his relation with his colleagues, with his seniors, juniors, so with his boss, or if he is the boss with the employees. So whatever it may be, you ask such questions, then you can get something which is very important, which is very individualizing. Then you can ask questions like, what is the worst situation you have faced in your life, and how did you react to that situation? So the reaction of the person will tell you. So it can be this also. Then it can be hobbies of the patient. From that you can find out that what is the real nature of the patient, what hobbies, the fears, the phobias. Sometimes the phobias or the fears are very, very individualizing, because they are the ones which are PQRS. They can be queer, rare, strange. Like, say, for example, I had a phobia, that is the fear of darkness. Now, say fear of darkness or phobia, if it is in a 6-year-old small child, that he is afraid or scared of going to another room where there is darkness. then it is not a individualizing symptoms. But say a 40-year male saying that I can't enter a dark room, I have to ask somebody to open that room and then I can enter that room. So then this is something which requires medicines. So such fears. Now, in case of a child, pediatric case taking, where the child is not going to tell you many things. So you may ask the child to draw something, and from the drawings, you can make up the psyche of that child. Or many a times the psychiatrists, they ask, they give them a pillow and they say that imagine kya kaun hai, who is this person, and then hit the pillow. So they like say that this is my elder brother, and then they'll hit the pillow. So you can make out that he has got that bad feeling, or he wants to hit the elder brother. So that is how you try to find out something from the child by asking such questions. Then it can be dreams, some repeated dreams which are coming again and again, and which if we get time, I'll talk about one dream of one patient. So that repeated dreams can help you in selection of the medicine. Now, again, I have a very good line which is written again by Dr. Dhavle, and I have shown the picture of a donkey, the animal. They listen with putting their ears up. So you have to be a very, very attentive listener when you are taking the case, and you listen with your ears, you listen with your eyes, your heart, and give the speaker your undivided attention. You are talking on a phone and the patient is talking, telling his history is not done. So undivided attention, your all senses, all attention must be to for your patient, because homeopathy, the homeopath must be an alert and attentive, because homeopathy refuses to reveal its secret to casual inquirers. If you are casually taking your patient, then you are never ever going to get the individualizing features of your patient. So you have to be a very, very attentive listener. Now, these are some of the things. The patient can be careless, dishonest, foolish, idiotic, impatient. He is not ready to give the history completely, inconsistent. He keeps on changing the symptoms, miserly, rude, unobservant. He is not able to observe what he is exactly feeling, untruthful, unpunctual, unreasonable, ungrateful. Now, see, these can be the qualities of a patient, but none of these defects or deficiencies in the patient should disturb the physician's attitude towards the patient. It should not change. We must keep on following the first aphorism that this is our mission, to restore the sick to health. So to cure, that is our mission. So irrespective whatever is the behavior of a patient, you see to it that your attitude towards the patient does not change. Then these are some of the qualities, as I said, of the physician, that the physician must be polite, well mannered, and have a sense of humor also, having to treat and greet the patient very nicely. And he should avoid some rude corrections when the patient is talking, or some contradictions with the patient. Okay, no, 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 this is not possible, this cannot happen. Or to get in an argument with your patient, or showing that you are something more, or you are having more knowledge, like contempt to the patient, or to become bitter to the patient, or to become abusive to the patient, that you are not listening to me and this is not proper. So see to it that you don't do such things in your clinic. And the physician has to be very sympathetic. He should aim to cure sometimes, to relieve often, but to comfort always. See, many a times you may fail in treating your patient to cure what he is suffering from, but whenever the patient comes to you, talks to you, then the patient must feel comfortable when he leaves your clinic. So even if the symptom is not cured, but if the patient is feeling mentally at peace, then you will feel that most of the time you have done your work. So this is very important. Now you see here, as there is a little time, I would say that a lady, there was one widow who was coming to my clinic for some menopausal after menopausal symptoms, and many a times I used to change the medicines, but I could feel that there is something. She was very, very sad always. And there was something that kept on bothering me also, that there is something which is not treated. I'm not able to restore the person to health. The restoration is not coming. The symptoms are coming, but the restoration is not coming. Now, repeatedly, I went on asking, but she said, no, no. And her impression was that she was a widow. She was a very pious lady, a very religious lady, and she was like regularly going to the temples and doing like kirtan and all those things. Then once I went on asking that there is something which is bothering you, what is it? And she started crying bitterly. And then she said that I stay in a place where there are some young boys staying, and every day in the evening, those boys come and sit in my courtyard in front of my house, and they are like my sons, the age of my son, like, and they are like talking, and they are having like, they help me out also sometimes when I need, and they are very good boys. But then she said that, but I have got some ill feeling in my mind that every day night I have lascivious dreams of those boys. And that disturbs me a lot. I go more and more to the temple. I do more and more kirtan. Why? Because I feel that something, there is still a sin in my mind, that I'm getting such dirty dreams for these boys who are just like my son. And so I feel that I am a sinner and I have to wash my sins away. And so I go more and more to the temples, and I'm more and more disturbed. Now, see, this was the thing which she told. And after that, I started searching the materia medica. In Steffi Sigeria, I read, Kant has written that reproaching oneself for indulging into sexual fantasy. Now, see, that is reproaching oneself for indulging into sexual fantasy. Now, that is how, by giving Steffi to that patient, it worked. It made, like, it worked very beautifully. And then afterwards, I read also in anacardium also that there are two personalities, there are two wills, as if the personality is split. That one is a will which is very, very good and it wants to do everything good, but then there is a devil. So it is a angel and the devil. So there is always a fight between the angel. Now, see why I'm telling you this, that these are the cores of the medicines also, and these are the cores of our patients also. So what is important, that you go to the core of your patient and try to match the core of your patient with the core of the medicine. Then and then similibus curanter is going to work. And so it is very important that your case taking, your case perception is complete. And so finally we say, I think my time is over. Yes, it's almost over. So finally we say that homeopathy is all about fulfilling the mission to cure an individual and in its real means. So this is the gist of everything, that how we go ahead with our cases and how we try to come to the similima. Okay. Thank you.
Thank you so much, ma'am. It was such a wonderful and informative session, especially the cases, aphorism, and remedy differentiation, which are very well explained by you, ma'am. Now, I would like to ask any participant, if anyone have any question, please ask to ma'am. Ma'am, one question from Dr. Nikita.
Yes.
What was
Yeah.
the potency given when you gave pulsatilla, ma'am, and repetition, and how was the recovery?
Which patient was pulsatilla? Nikita, Dr. Nikita? Yielding disposition, I think so, about the patient, yes, about the acne. Acne, most probably I usually gave the low potency, so it was 30 potency. And it was like repeated, the patient took almost 3 months to get cured. So it was repeated every week. Dr. Jeel?
Yes, ma'am.
Yeah.
If any participant have any question, please ask to ma'am. Ma'am will address your question. So there is a no more question, ma'am.
Okay.
Thank you so much, ma'am, for your session, and you took a time for us from your busy schedule, ma'am.